Hi, I'm Dr. Robert Nucci. In this video, I'm going to discuss the difference and advantages and disadvantages of a cervical disc replacement versus a cervical fusion, and maybe try to explain a bit when you use one versus the other. Generally, cervical disc replacements and cervical fusions are done for disc injuries and disc degeneration in the neck. And the cervical fusion is a very typical way that we've been doing cervical surgery for a long time. There's a model here of the spine. This is the cervical spine. And here, that's a side view of the cervical spine, and the spine will move, bend forward and bend back. In between, or I should say here, the bones of the spine, in between the discs of the spine, will allow you to bend and move. Sometimes there is a disc injury or disc problem, and that disc needs to be removed in its entirety to treat the problem. Once you do that, there's a space where the disc used to be, and we found out that it's probably a good idea to fill up that space with something and not just let it sit there. And there's a couple of options for that. One is a fusion, where you're taking bone and you're putting it between where the disc was, so the bone above and below become one big bone. And another option is to put in a disc replacement between those two bones where the disc was, to allow the spine to bend and move more like it did before. The reason you would do a cervical fusion or a cervical disc replacement is fairly technical. Basically, in a cervical disc replacement, there has to be a fair amount of disc left before you remove the entire disc, because if the bones are collapsed one another, it's harder technically to get in that disc replacement. You have to remove a lot of bone, and that can cause problems and instability and so on. So in certain cases, you can use a cervical disc replacement. In several cases, you need to do a cervical fusion. The advantages of a cervical disc replacement, cervical fusion, one versus the other, are probably a little bit misunderstood in my mind. Many patients come to me and say, I want to have a disc replacement, not a fusion, because I'm going to lose motion in my neck. I don't want to lose motion and so on. And the truth is that you lose very, very little motion in your neck with a cervical fusion. Most of the motion in your neck happens at the skull and the top of the neck. You lose a little motion, and generally when patients come in, they've already lost the motion in their neck before they've ever seen me. And if you fuse their neck at one or more levels, they don't really notice much difference before and after the surgery. So that's not a real good reason to do a disc replacement versus a fusion, when you can maybe go either way. The main reason to do a disc replacement is that it can prevent, and does prevent, degeneration above and below the area of the surgery. When you move and bend your neck, you're moving all those discs around. If you fuse one of them, the other ones move more to make up for that lost motion. And we found out that degeneration is faster above and below the area of a fusion than it would be if you didn't have a fusion or if you had a disc replacement. And we don't want the spine to degenerate, of course. That can lead to further surgery. It may not, but it certainly could. So why have that if you don't need to have it? So the main reason to do a disc replacement, if you technically can do it, if there's enough room to get that disc replacement in, it is because it will prevent, or should prevent, degeneration above and below, so you won't need further surgery potentially down the road. I don't know if you can appreciate it, but I will try to show you. This one is a cervical fusion. It has a cage and screws in here, so it's not moving. This one here is a disc replacement that is like a small little knee replacement, and it will allow the spine to bend and move. Now I can take it apart, and you can see it's sort of a ball and socket joint in there. It's magnetized. The real one is not magnetized. It allows you to bend and move, so the discs above and below will potentially not degenerate as much. So that's the broad sense, the difference between a fusion and a disc replacement, and maybe some of the advantages and disadvantages of using one versus the other, if you technically could go either way and use either one. And this is Dr. Robert Nucci with Nucci Medical. Thanks for watching this video. For more information, please visit our website at nuccimedical.com, where there are actual videos or animated videos of these procedures. And if you have any other questions or comments, please don't hesitate to write a comment below. Thanks very much.